I'm Dr. David Marais, head of the Lipid Clinic at Groote Schuur Hospital and of the Lipid Laboratory at the University of Cape Town. On the topic of lipids and lipoproteins, I need to mention first that lipids are substances containing carbon, hydrogen, and a few other atoms that are insoluble in water and therefore commonly aggregate together in the blood. They transport in the blood as lipoproteins. There are two main forms of lipids of medical importance, and they are cholesterol and fatty acids. Fatty acids are strings of carbon molecules with oxygen at the alpha end, and the omega end is the end at which we describe the position of double bonds in essential fatty acids. The fatty acids can be short chain, such as in butter, medium chain, such as in coconut oil, and long chain, which is of relevance to plants and animals and health and disease. The fatty acids may have double bonds. If there are none, then it's called a saturated fatty acid. If there's one double bond, it's a monounsaturated fatty acid. And if there are several double bonds, it's polyunsaturated. And the omega-3 unsaturated fatty acids come from marine sources and are essential as the body can't make them. The omega-6 fatty acids can't be made in the body either and come from terrestrial plants. Cholesterol is an essential fat that is part of cell membranes and is made in every cell in the body, but can also be assimilated from the diet. Fats are transported through the blood in particles called lipoproteins, where proteins enable the assembly and also target the lipoproteins to different places. We eat several gram amounts of fatty acids per day and milligram amounts of cholesterol per day. Those are transported from the intestine in chylomicrons, delivering triglycerides to the muscle and returning the remaining fats to the liver. In between meals, the liver will secrete VLDL, which lipoproteins will also provide triglyceride to muscles and adipose tissue, but some of the VLDL will form LDL, which is a cholesterol-rich lipoprotein and can supply cholesterol to cells needing it. Generally, the liver will take up most of the LDL, and the cholesterol that is in excess in the rest of the body will return to the liver through particles called HDL. Lipids and lipoproteins are part of normal health, but certain excesses of lipids or lipoproteins can cause disease.